Artificial intelligence is proving to be a total game changer in global health. It's promising these huge leaps forward in how we diagnose and treat diseases. But as AI gets smarter and more powerful, it forces us to ask a really critical question. Is this revolution going to help everyone equally? Or is it just going to make the existing inequalities even worse?
And this quote from the head of the World Health Organization, man, it just hits the nail on the head. The stakes couldn't be higher. We know the future is digital, but we have to be so careful that it doesn't become yet another way to divide us. Okay, so let's get into it. So that's the big question we're tackling here. This isn't just about coding better algorithms. It's about architecting a better and much, much fairer system for the entire world's health.
Okay, so first up, let's talk about the upside. The sheer potential here is absolutely mind-blowing. And to really get what's possible, we need to rewind the clock to the very start of the last global pandemic.
Just let that sink in for a second. Before the 24/7 news cycle, before the lockdowns, before most of us had even heard the term novel coronavirus, some algorithm out there was already connecting the dots and raising a red flag. Okay, so check out this timeline. This is where it gets wild. On December 30th, this AI system called Blue Dot was just churning through tons of data, news reports, public health forums, even airline ticket sales. It spotted a weird cluster of unusual pneumonia cases in Wuhan and flagged it. And get this, it sent out an alert a full 9 days before the WHO made its official announcement. That, right there, is the power of AI.
And look, that early warning system, that's just scratching the surface. The World Health Organization sees AI as a key to literally transforming everything, from how doctors treat patients to how quickly we can develop new drugs, all the way to managing entire healthcare systems, especially in places where they just don't have enough doctors or nurses.
But, and this is a huge but, for all its amazing potential, this incredible technology is being built on a foundation of deep, deep global inequality. And if we're not really, really careful, it could actually make everything a whole lot worse.
Okay, let's put some numbers on this. The African continent carries a full 25% of the entire world's disease burden.
But to deal with all that, they have just 3% of the world's healthcare workers. That gap is just staggering.
But this number, this is the one that's truly scary. Only 1% of the health data that's being used to train these powerful new AI systems actually comes from African populations.
So you gotta ask, right? If an AI is trained on data that doesn't include you, that doesn't represent your biology or your environment, can it really help you, or could it actually end up hurting you?
And this gets us to the heart of the problem, something called algorithmic bias. It's pretty simple, really. When you train an AI almost entirely on data from people in wealthy Western countries, it gets really good at helping those people. But when you try to use that same tool on diverse populations in Africa, it can fail badly. And the fallout from this? It's not just theoretical. We're talking real-world harm, wrong diagnoses, treatments that are ineffective or even dangerous, and a high-tech system that doesn't just mirror the world's inequalities, it actually makes them bigger.
And if that wasn't enough, this whole data issue is just one piece of a much bigger, messier puzzle. You've got a massive digital divide where less than a third of people have reliable internet. You've got a constant brain drain of skilled doctors and nurses leaving. And you've got this heavy financial reliance on outside help to fund any new tech. It all just piles on.
Okay, so that sounds pretty bleak, right? The challenges are huge, but, and this is a big but, they're not impossible to solve. The way forward needs a two-part strategy, one that works from the very top all the way down to the grassroots level, all at the same time.
So think of it like this. From the top down, you need big global organizations setting the rules of the road, making sure AI is safe, ethical, and fair for everyone. But from the bottom up, you need clever, practical tech solutions that can actually work on those roads, especially in places with spotty internet or limited resources. One part can't work without the other. They have to work together, hand in hand.
So let's look at that top-down piece first. The World Health Organization is already laying the foundation. They're creating global standards for safety and ethics. They're helping individual countries build out their own secure AI systems. They're offering training to get local experts up to speed. And they're bringing everyone to the table to make sure it's all done collaboratively. Now, having that global framework is absolutely essential. It's the blueprint for a fair system. But what good is a blueprint if you don't have the tools to build the house, especially when you can't count on a fast internet connection or a giant faraway data center? And this is where that bottom-up solution, the tech solution, comes in. It's a concept called edge computing. So instead of sending massive amounts of patient data to some server in the cloud thousands of miles away, edge computing does all the heavy lifting right there, on-site, on a local device, in a mobile clinic, wherever the data is being collected.
And you can see how this one technology starts to solve so many of the problems we've talked about. It delivers real-time AI insights even in places with bad internet. It cuts down on delays, which is critical when a life is on the line. It's way cheaper than sending tons of data to the cloud. And maybe most importantly, it keeps sensitive patient data local and secure. It makes the big global vision actually work on the ground.
So all of this brings us to this really pivotal moment, a genuine crossroads for the future of global health.
And the choice we have to make is incredibly clear. We can just let this technology run its course and risk deepening the huge gap between the world's haves and have-nots. Or we can make a conscious choice to build it as the great equalizer, a tool that brings the best healthcare to every single person, no matter where they live.
AI isn't destiny, it's a tool, and the story of what this tool does for humanity is still being written. The real question is, who gets to hold the pen?